I am Professor Dr. Vivek Gaur. I am a maxillofacial surgeon and I am practicing in Kaushambi, Delhi NCR. My clinic name is Implant Clinic, and this clinic is specialized for doing a corticobasal implants. Corticobasal implants means immediate function loading implantology, and we practice and we operate and we do the implant implants. They are the pioneers in immediate loading. They are the first in the immediate loading, and they are from Switzerland. When a patient comes to the office and I do the clinical examination and patient shows the interest that yes, I want to go actually with immediate function loading protocol having a corticobasal implants. So how we are going to do it? I have to explain to the patient. What the first step I do. The first step is actually the clinical examination of the patient. Explaining the patient about the defect, what your condition of the mouth is there. What all the teeth I am going to extract, I am going to remove and place the implant. How your jaw will look like and what material of the teeth I will be using. In my practice, I always tell to patient, you don't have an option to choose what teeth you will be having. You know why? It looks a bit strange and absurd, but I am telling you scientifically. Because a doctor who is operating, he knows what is the best is there for you. So I prefer actually, and I tell them they are going to have a graphene or zirconia or ceramic. But then if the patient agree with all the things, then I write actually the blood examination. Blood examination means if you are a diabetic, should be controlled diabetic should be there. If you are a hypertensive patient, you have to continue monitor your blood pressure. We don't want any actually surprises while operating. Okay, everything has to be taken care of very well. And the other ailment you are having, or actually you having a thyroid is there, or you are taking some corticosteroid drugs or anything, or rheumatoid arthritis, you have to check. Then the patient have sent me the blood report, everything is okay. So what we do? First day morning, we operate. It hardly takes, if you doesn't have any teeth in the mouth, it hardly takes 1.5 hours. 1.5 hour duration is, you sit on the dental chair, I give the injection. Injections are very good injections are there. I use the article injection. By the way, injections are never good, but they are very, very less painful. The article injections are there, very friendly and very less painful. Then I numb the jaw. If I have to take out the teeth, I take out the teeth. If it's not needed, I place the implant. So with the teeth, multiple extraction I am doing some bone contouring, everything. It can go to maximum 3 hours, not more like that. So I place the implant, and if you have no teeth are there, it takes maximum 1.5 hours. I place the implants, I take the impression. Meanwhile, I will be talking, joking to you also, okay? And then after that, after taking the impression, I prescribe the medicine. Tell the patient for 24 hours, you have to take everything cold, okay? And just relax, watch TV. You can go actually to your house or to the hotel and rest. Late evening, I call the patient and I want to do the metal fitting trial. Metal trial means the framework we are going to make that is going to splint all the implants, and that is in the evening. Why I'm calling? Because in my implant clinic that is there in Kaushambi, in my implant clinic, it's a very advanced center is there. I have a very huge dental clinical lab setup is there. Okay. So this I can do within 6 to 8 hours. I can create actually the metal framework. And then I call the patient in the evening. I do the metal fitting, check everything. If everything's fitting over the implant perfectly, then I show the teeth, what type of the teeth they will be demanding, or what will be the better, what shape and size and color will be better for the patient. And then I send the patient, then I call the second day after the lunch. If I am giving a graphene, I call the patient after lunch. If I am doing a ceramic or zirconia, I call the patient second day late evening, and I fix the teeth. I cement the teeth, and then I do a preliminary checkup, both the side, the contacts are good, and then I send the patient. I tell the patient, now you can start having hot and you start chewing. Chewing means actually cautious, you start eating food. Then I call the patient after 2 days for checkup. Checkup means how both the side bites are there, pressure is there. Then after 3-4 days, then within actually 3 weeks, then within 6 weeks, then after 4 months, then I tell the patient, come visit me just for a checkup, 6 months or annually, anytime you can come. It's all free of cost. Just do the maintenance and you will always be okay.